Yani Millet Jamaat, thank you all for joining today's webinar on the Affordable Care Act. My name is Ember Ladek. I'm a clinical pharmacist, and I also serve on the National Health Board as the deputy lead for the Healthcare Access Portfolio. I'm joined today by Jamil Habib, our subject matter expert. He's a financial service professional, and he's had experience in the insurance agent industry for 20 years. We also have Ferengis, who will be assisting with translating in the Dari language. Thank you both, Jamil and Ferengis, for joining us today. The purpose of this webinar is to review what the Affordable Care Act, or ACA, is and any new updates. We'll aim to address some of the most frequently asked questions regarding the ACA and health insurance. We will dedicate some time at the end to answer any questions you may have. In the meantime, please do enter any questions you have in the chat box.
جماعت عزیز یا علی مدد تشکر از اینکه امروز در این وبینار معلوماتی قانون مراقبت مقرون به صرفه یا Affordable Care Act اشتراک نموده اید. در این وبینار ما امروز با خود خانم امبر لدک را داریم که مادریتور یا مجری برنامه هستند. ایشان یک فارماسیست کلینیکی و همچنان در بورد ملی صحت آقاخان من حیث معاون بخش دسترسی به خدمات صحی خدمت می نماید و ما همچنان آقای جمیل حبیب را داریم با خود که آقای جمیل کارشناس حرفه‌ای موضوع وبینار امروزی ماست. ایشان متخصص خدمات مالی بوده که بیشتر از 20 سال در عرصه صنعت بیمه فعالیت دارد و من فرنگیز هستم که در بخش ترجمانی به زبان فارسی داری امروز شما را هم کمک می نمایم و هدف از این برنامه امروزی ما این است تا یک مرور روی قانون مراقبت مقرون به صرفه یا Affordable Care Act را داشته باشیم. یعنی اینکه قانون مراقبت مقرون بر صرفه چی است و چگونه بتوانیم معلومات را در مورد آن با شما شریک سازیم. در جریان این وبینار ما کوشش می‌نماییم که به برخی از سوالات و پاسخهایی که شما در این رابطه داشته باشین جوابگو باشیم و در عین حال اگر کدام سوال در لابلای وبینار در ذهن شما کار کرد شما میتونین در چت باکس را یا در باکسی که مسیج میتونین اونجا ذکر کنین. ما در اخیر به تمام سوالات شما جوابگو خواهیم بود. تشکر. Yes.
Thank you, Ferengis. Before we begin with our panelists, I'd like to invite Dr. Salima Jaffer, the National Outcome Health Board member for Healthcare Access, to share with us why health insurance is so vital.
Good everyone. Like how Amber said, we welcome you all to this very important webinar, and we are grateful for your presence here. In light of Maulana Hazramam's recent visit to the United States, tremendous emphasis has been placed on making health our highest priority. Annual health screenings play a vital role in preventing long-term chronic illnesses and in enabling early detection of serious conditions like cancer. My hope is that every family will take advantage of this opportunity to learn more about their health and to stay informed about the latest updates regarding the Affordable Care Act for the 2025-2026 cycle, as we have lots of resources to share with you. Thank you, Amber.
Thank you, Dr. Salima. دکتر سلیمه جعفر مسئول ملی پورتفولیوی دسترسی به خدمات صحی در بورد صحت آقاخان هستند. دکتر سلیمه موضوعات را روی این که چرا اخذ بیمه صحی بسیار مهم و ضروری می باشد با ما اشتراک گذاشتند و از حضور شما در این وبینار استقبال نموده و تشکری نموده و با توجه به سفر اخیر مولانا حضرمام به ایالات متحده که بیشترین تاکید روی صحت و سلامتی شده بود اونا اشاره نمودن و بنابراین موضوع صحت و سلامتی را در بالاترین اولویت قرار داده است. به همین منظور معاینات سالانه صحی شما نقش بسیار مهمه در جلوگیری از بیماری های مزمن در دراز مدت و تشخیص زودهنگام بیماری های جدی مانند سرطان را دارند. و ما امیدوار هستیم که هر خانواده از این فرصت استفاده نموده تا بیشتر درباره صحت خود بیاموزد و از جدیدترین معلومات مربوطه به قانون مراقبت مقرون به صرفه آگاهی حاصل نماید. Thank you.
Thank you. Thank you, Dr. Salima, for sharing that. Health insurance really helps provide an avenue to prioritize our health. I know many people who aren't eligible for Medicaid or insurance through their employer have been able to obtain health insurance through the health exchange, which is established by the Affordable Care Act. We also refer Affordable Care Act as ACA, so you'll hear us refer to that in this presentation today. You may have also heard it referred to as Obamacare. We will call it ACA. Open enrollment for 2026 coverage is now underway with the December 15th deadline fast approaching. Jamil, let's bring you into this conversation. Can you help provide a quick overview of what the ACA is and some of the aspects of health insurance?
Thank you, Amber. Yalimad, everyone, and thank you for having me. So this year marks the 13th annual ACA open enrollment. I want to mark that because that has been a long while that our Jamaat has been able to access health through the ACA. The ACA was really established to help those people that don't get coverage from their employers or through Medicare or Medicaid, so they can take advantage of the different plans that are offered in the marketplace. I think perhaps the most important part of the ACA has been that they cover pre-existing conditions from day one when you sign up for a plan. They also provide different preventive care screenings. Also, one thing that did not exist before the ACA was that now when you have a health plan, there is no life dollar limits. It used to happen that in the past, there would be about $1 million limit on your plans. And unfortunately, if you hit it due to a serious health issue, you would be dropped by the insurance company. And that is something that the ACA addressed. No limits. Also, the insurance companies cannot drop you illegally just because you've had a higher claim in one of the years. So your premiums do not increase next year just because you had a high claim or you had some health issues. The marketplace, contrary to some belief, these are not government plans. Once you go to the marketplace, you actually get to buy private insurance through the major private health insurance companies that sell plans there. So that's something that I think is something that everybody gets it from the point that they have different options to buy insurance companies from major health companies. Ferengis?
Sure. Yes, thank you. ببینید اینجا آقای جمیل اشاره کردن که ما آقای جمیل و انبر اشاره کردن که می ACA را به نام اوباما کیر هم ما میتونیم یاد کنیم. پس نکات مهم یا عناصر مهمی که در ACA یا Affordable Act ضروری است که باید در نظر بگیریم. کدام ها هستن؟ اونا مثلا اینجا هایلایت کردن که گفتن بیمه درمانی را به افراد بدون بیمه که دارای شرایط پزشکی از قبل موجود هستند ارائه میدهند و همچنان مراقبت های پیشگیرانه رایگان را فراهم میکنند و همچنان محدودیت های دلاری مدام العصر و سالانه را پایان میدهند و دیگه گفتند که همچنان امی ACA یک امکان مقایسه آسانتر طرح‌های مختلف را در بازار بیمه را فراهم می‌کند و دیگه ای که از همه مهمتر که غیر قانونی می‌سازد که شرکت‌های بیمه درمانی به طور خودسرانه امی بیمه شما را لغو کند که این بسیار نکات مهم است که ما خوب است بفهمیم به خاطر از این برنامه به خاطر ACA. Yeah. Jamil?
Thank you. So, who's eligible? Of course, other than being a US citizen, as you can see on the screen, starting from being a green card holder to there are many immigrant statuses that can continue to buy health insurance on the marketplace. I will tell you that there has been quite a bit of news on the media regarding immigrants being able to buy. I want to clarify that if you were able to buy a health insurance plan based on your immigrant status in 2025, you will be able to buy it in 2026 as well. The only exception is DACA recipients, the Deferred Action for Childhood Arrivals. While they were allowed to get health insurance from the marketplace in 2025, unfortunately, they will not be allowed to do so in 2026. Rangiz?
اوکی. ببینین در بخش eligibility یا واجد شرایط صحبت کردن که کیها میتونن که واجد شرایط ای برنامه یا می پلان باشن. قسمی که در سلاید میبینین که کسایی که میتونن از این برنامه یعنی استفاده کنن کسایی که گرین کارت هولدر باشن یعنی که گرین کارت داشته باشن یا افرادی که دارای اقامت دائمی باشن، پناهجویان، پناهندگان، مهاجرین و کسایی که ویزه کاری داشته باشن، ویزه محصلی یا محصلین یا ویزه دانشجویان اونا میتونن از این برنامه مستفید شوند. و همچنان کسایی که مثلا در حالت وضعیت حفاظت موقت هستند که بر اونا TPS میگن، درست؟ اونا هم میتونن از این برنامه مستفید شوند. و همچنان کسایی که در اینجا ذکر شده که شهروندای آیلند مارشال و تنها کسایی که گفتن نمیتونن از این برنامه مستفید شوند امو کسایی هستن که امو ستاتس یا لقب DAS دارن یا داکار دارن که اونا نمیتونن در این برنامه اشتراک کنن. و همچنان اینا ذکر کردن که اگر شما با در سال 2025 خود را در این برنامه اشتراک راجستر کنید، پس اونمو در سال 2026 اتومات میتونن که شما میتونین که هم دوباره مستفید شوین از این برنامه. یعنی اگر دمیم 2 ماه یا 1 ماه آخر سال 2025 شما راجستر کنید، پس خود به خود در سال 2026 شما هم میتونین که با همون لقبی که دارین فعلا از این برنامه ها استفاده کنید.
So the last slide in this segment, I would like to cover the 5 major components of a health insurance plan, right? So let's just talk about that first. The premium is essentially the premium that you pay on a monthly basis, just like you pay the premium for a car or for your homeowners. This is premium that you will have to pay regardless of the fact that you use the health insurance or not. I want to point out that if you are not able to pay the premium and your plan does get canceled, unfortunately, you will not be able to reinstate it during the year and would need to wait till the next open enrollment to re-enroll again. Premiums are due like rent at the beginning of the month, so please make sure that you are making your premium payments on time. And then the next 4 components come into play when you actually use the health insurance, right? So the first one, and perhaps the most simple, is what you call a copay. These are defined with fixed dollar amounts in your health plan. So if your health plan has a stated dollar amount for, say, office visits, specialist visits, generics, so on and so forth. Well, that's the amount you will pay. That is all you will pay, regardless of what the doctor charges. Whatever else balance, the insurance company will pay for it. Okay. Then comes the deductible. So for those services on your plan that doesn't have a defined dollar amount, and generally these are denoted by a percentage, for all those services, you need to first meet the deductible. This is generally a dollar amount. Some will have it for $500, some would have it for $1,000. Some even come up with $0 deductibles. But if there is a deductible, you would have to pay that whole deductible. You're 100% responsible for it. Then comes a co-insurance. This is essentially a partnership between your health insurance company and you. Most co-insurances are defined, again, in percentage, and these are either 80-20, 30-70. I've even seen plans that are 50-50. Generally, the smaller portion is what you would pay, and the rest is covered by the insurance company. And the final number, and I think perhaps the most important, is your out-of-pocket maximum. Um, Anything that you pay during the year, not including the premiums, but whatever co-pays that you pay, whatever deductibles you pay, whatever co-insurances you pay, once you reach the out-of-pocket maximum limit from that point till the end of the year, the insurance company will cover you at 100%. Ferengis?
اوکی. ببینین اینجا در بخش elements یا امو عناصری که در بخش بیمه ضروری است که ما شما حتما با بعض اصطلاحات اینجا آشنایی داریم که پریمیم هستن، کوپی، دیدکتیبل، کوانشورنس و out of pocket maximum. میرم کوتاه در مورد هر یک از یا کمک معلومات میتونم قسمی که آقای جمیل تشریح کردن. پریمیم امو مبلغی است که شما هر ماه برای بیمه صحی خود پرداخت میکنید. این مبلغ حتی اگر از بیمه این مبلغ همون مبلغی است که اگر شما از امی پریمیم خود استفاده بکنید یا نکنید، ولی شما مجبور هستید که هر ماهی را باید پرداخت کنید. و همچنان اینا تاکید کردند که بسیار مهم است که پریمیم را در اوایل هر ماه بپردازید که اگر پلان شما لغو گردد باز دوباره فعال نخواهد شد و شما بدون امی بیمه خواهد ماند و تا زمانی که بتوانید دوباره در دوره ثبت نام عمومی در اواخر سال ثبت نام نمایید. یک تاکید کردن که باید هر ماه باید در اوایل ماه امی پریمیم خود را پرداخت کنیم. بخش دیگهش کوپی است که کوپی امو مبلغ ثابتی که شما برای بعضی خدمات مطابق با پلان بیمه خود پرداخت میکنین، معمولا برای مراجعه و بازدید دکتر فامیلی شما که بعضا در موارد مراجعه به دکتران متخصص و همچنان برای نسخه و ادویجات از کوپی پرداخت میگردد. درست است؟ و در بخش دیدکتیبل باید گفت که دیدکتیبل برای تمام خدماتی که در پلان کوپی شما ثابت نشده باشد، ابتدا شما مسئول پرداخت مبلغ دیدکتیبل هستید. خدماتی که معمولا نیاز دارد اول دیدکتیبل پرداخت شود، مانند اکسری، ام‌آرآی، حالتهای اضطراری و جراحی، بستری شدن در شفاخانه و غیره. و در بخش کوانشورنس باید بگویم که اینا ذکر کردن که کوانشورنس درصدی از هزینه خدمات صحی تحت پوشش بیمه که شما بعد از پرداخت دیدکتیبل میپردازید. کوانشورنس معمولا به شکل فیصدی مانند 20% یا 30% تذکر میگردد. یعنی پس از پرداخت دیدکتیبل شما 20% یا 30% هزینه این خدمات رو پرداخت میکنید. و در آخر اینا در بابت out of pocket maximum limit صحبت کردن که بیشترین مبلغی که شما در یک سال بیمه برای خدمات تحت پوشش باید بپردازید، اینمی out of pocket maximum است که وقتی شما این مبلغ را برای دیدکتیبل یا کوپی و کوانشورنس در خدمات داخل شبکه پرداخت کردید، بعد از آن دیگه پلان بیمه شما 100% هزینه مزایای تحت پوشش را میپردازد. So, yeah.
Okay. Thank you both for that summary. I know I work in health insurance, I work with health insurance pretty much every day in my work, and I still get confused about these concepts. So thank you both for reviewing that, and I think I might have to come back to this myself to look at. Another thing that sometimes can be confusing, I think, with the Affordable Care Act, I think the big thing about the Affordable Care Act is that it made insurance affordable for a lot more people, like you mentioned, Jamil. And the way it did that is through certain discounts. I think there's more than one, which is what can cause the confusion. Can you help kind of explain how I can find out if I qualify for one or more of these discounts?
Yes. Thank you, Amber. That's actually a good segue to now talking about the affordability of what's going on. And while we will cover the enhanced tax credits here fairly soon in this presentation, let me quickly talk about the two different types of financial help that you get through the marketplace. The first one is the tax credit that you get. In the next slide, we will see that based on your family size and your income, you may qualify for the premium tax credit. This helps lower your monthly premium. The second one that you get is the cost sharing subsidies. Now, individuals, families that are on the lower side of their income get some help with their deductibles, copays, out of pocket costs when they use their health plans. And we'll talk about that in the next slide.
اها ببینین در این سلاید آقای جمیل در مورد هالمارکس of ACA یا ویژگی های ACA صحبت کردن که به طور خلاصه براتون مختصر تشریح کنم که اینا گفتن که دو نوع تخفیف مالی وجود دارد که اگر ما واجد شرایط این برنامه باشیم. اولی که کردیت مالیاتی یا تکس کردیت کمک میکنه که مبلغ پریمیم بیمه صحی شما کاهش یابد، که و موضوع دومی هستند که کاهش هزینه ها یا cost reduction که به آن سبسیدی نیز گفته می شود. زمانی که از بیمه صحی خود استفاده میکنید، هزینه هایی را که شما باید بپردازید کاهش می یابد. خدا کنه که اشاره تانسته باشم دقیق تر. یا جمیل؟
Yeah. So this slide is where the rubber hits the road, as they say. So if you will look at, this is for the 2026 enrollment. As you can see, based on your family size, if you are between 100% of the federal poverty line, the FPL means the federal poverty line, so if your income based on your family size is between 100% of the FPL or 400% of the FPL, you will qualify for the first discount, which we call the premium tax credit. The way the premium tax credit works is, and 90% of the people do this, when you pick the plan, you ask the government to pay the insurance company on your behalf, and whatever is the net premium is what you get to pay. A lot of times when you look at the premiums on the marketplace, you will see that there is this really huge number and there is a line drawn across it, and then there is another number on the top which is lesser, and that is your premium, and that is because the tax credit has reduced the base price of your plan. The second discount that you see is between the 100% federal poverty line and the 250% of the federal poverty line in the green. If you are in between there, you will also qualify for cost sharing reductions, as I mentioned earlier, or we call it subsidies as well, that lowers your out-of-pocket costs like your deductible and your copays. Do keep in mind, though, that in order to avail or you to utilize the second discount, you have to buy a silver plan because silver plans are the ones that have the variable out-of-pocket costs. The gold and the bronze plans are not the ones that you do that. I will tell you that, and we'll talk about that, if your income is below 100% of the federal poverty line or above 400% of the federal poverty line, you can still buy insurance on the marketplace, but you would not qualify for the discounted rates of your premiums. Ferengis?
Thank you, Jamil. ببینین در این قسمت یا در این سلاید این قسمی که اینجا عنوان دادن در پایین میچاکات Federal Poverty Guidelines که ما در فارسی به اون میگیم سطح فقر دولت فدرال. در اینجا خب اینا مثال های زیاد دادن، ولی من به طور فشرده یا کوتاه براتون بگویم که ببینین در یک قسمت از این چاکات تعداد هاوسهولد یا کسایی که سرپرست خانه است اونا رو نشاندن یا اعضای خانواده که هر امی پلان مطابق به تعداد خانواده فرق میکنند، به تعداد خانواده و به تعداد درآمد ما و شما متفاوت خواهد بود. که این سلاید عموما نشان میدهد که برای واجد شرایط شدن تخفیف و یا همون سبسیدی که ما گفتیم و درآمد شما باید بین قسمی که در چارت میبینین بین 100 تا 400 فیصد سطح فقر دولت فدرال یا FPL باشد. درست است؟ که بر اساس اندازه هر خانواده محاسبه می شود و محاسبه می شود و دیگه ای که شما می توانید برای سطوح مختلف تخفیف واجد شرایط گردید. دیگه ای که گفتن اگر درآمد شما بین 100 که در چارت می بینین که اگر درآمد شما بین 100% تا 200% باشد، در برابر یمی FPL باشد، شما همچنین تخفیف دوم را دریافت میکنید تا دیدکتیبل یا و کوپی های خود را کاهش دهید. که قسمی که در اینجا مثال داده، شما میتونید که یک اسکرین شات از زیر بگیرین و بعد نظر به تعداد خانواده و درآمدتون، پس شما میتونید که اما محاسبه خود را انجام دهید. Yeah, thank you.
Thank you. Thank you both for that overview. I know this part can get a little technical, so I appreciate you walking us through that. I also want to mention, I know I see there's a lot of questions. I know there's been a lot of buzz around ACA this year, so I know many of you have questions, and I also see some raised hands. So if everyone can please put your questions into the Q&A box. I think I misspoke earlier, but there is a Q&A box where you can put your questions, and we will address the questions at the end of our presentation. As I was mentioning, the confusion kind of going into 2026. So, there's been a lot in the media about how ACA is changing or it's not changing. I feel like it's been back and forth and, things are still up in the air. But what do we know? What are the new rules that are going to change for 26, or are there any new requirements for being able to get a plan through ACA? Tell us what's going on, Jamil.
Yes, so Amber. So let me start by first establishing what is not changing. Okay, and you're right. There has been so much news in the so much information in the media that I think sometimes it's hard to keep track of it. So let's talk about what's not changing. So the Affordable Care Act remains firmly in place. It is still the law of the land, and it continues to be it. The premium tax credits continue to be available at their original levels. Before they were increased by the enhanced tax credits of 2021. And we'll talk about that real soon here. Cost sharing subsidies are still in effect. So as I mentioned just a slide ago, that if you are within the 100 to the 250% of the federal poverty line, you will still qualify for that second out-of-pocket reductions. Most insurance companies are returning 2026 and still have a wide range of plan options available. And both the federal marketplace, where some states sell their health insurance plans, and all state-based marketplace, all exchanges are actively conducting open enrollment. So this is established, and regardless of what you may hear otherwise, please do not listen to all the myth and misinformation that may be going around. Ferengis?
Thank you. ببینین خانم انبر و آقای جمیل اشاره کردن که در این اواخر در میدیا یا در می اخبار و نیوز چیزا معلومات های مختلف در بابت امی بیمه صحی و چیزا نشر شده هستن که گفتن خیلی بیاین ببینیم که نظر به اخبار و نظر به تمام قانون و شرط شرایط چی چیزها در سال 2026 تغییر خواهد کرد و چی چیزها تغییر نخواهد کرد. درست است که اینا گفتند که سوال کردند که قوانین جدید برای سال 2026 چی خواهد بود یا چی است. اونا جواب دادند که جمیل میگن که چیزی که امسال تغییر نمیکنه و قسمی که در چارت در سلاید هم شما میبینید گفتن چیزی که امسال تغییر نمیکند این است که قانون مراقبت مقرون به صرفه یا همی ACA یا همی اوباماکر هنوز قانون کشور خواهد بود و هست. دیگه ای که کردیت مالیاتی و سبسیدی یا همون تخفیف که ما برشان میگیم همچنان برای کسانی که واجد شرایط هستن موجود است و ممکن است که این تخفیف ها به اندازه که فعلا در سال 2025 هستن بزرگتر و پررشتر نخواهد بود، اما همچنان بازم قابل توجه هست که یعنی نادیده نباید بگیریم. درست؟ Thank you, Jamil.
All right. Thank you, Fergie. So now let's talk about what are the new rules that are changing. And this is still apart from the enhanced tax credits going away. Earlier this year, the OBBA was passed, and there was also a rule that was passed by the marketplace called the integrity rules. And they have they have come up with a few rules that are going to directly impact our Jamaat, so we should take care of it. So let me first address this issue about affordability of the marketplace. So if you look at the column in the orange, the American Rescue Plan Act. In 2021, this was passed, and what it did was it brought in the enhanced tax credits. What that meant is that the premiums were discounted even more deeply. And as you can see, that people that were on the lower end of the income, up to 150% of the federal poverty line, they didn't have to pay anything. Now, these are percentages of what you will pay in your of your income, annual income, towards the benchmark silver plan. Okay, each county has their own benchmark silver plan, which is the second cheapest plan. Now, obviously, if you buy a plan that's more expensive than the benchmark, you will obviously pay more. But most people, if they were able to get a benchmark plan, the second cheapest one, they would have had to pay $0. And for the last 4 years, we have seen many people that were paying $0 premiums for their plans, or nominal single digits, or maybe even less than $25, right? And also what the American Rescue Plan did was, for people over 400% of the federal poverty line, they were now able to buy health insurance with some tax credits. And it was fixed and it was more of a sort of a slope. As their income increased, obviously they had to pay more, but they still were able to get tax credits for, even if their income was higher than the 400% federal poverty line. Well, all that changes because the enhanced tax credits end, as of the way they stand today, on December 31st, 2025. So what are we facing now, and why are we seeing an increase in the premiums? Is because we are now going back to the original tax credits that were there before 2021, and that is in the blue. And as you can see, the amount of money that we will pay out of our pocket at the different levels is higher, and in some cases, quite a bit higher. And I think the biggest one is that over 400% of the federal poverty line, people that have high income, that for the last 4 years were getting tax credits to reduce their premiums, are not going to be able to get that. What that means is that people above the 400% federal poverty line are paying full price for their premiums. To add to that, we know that because of the insurance companies having to pay out a lot of claim in the last few years, especially after COVID, many of them had a tremendous increase in their base price. Some companies actually increased their premiums as much as 40%. All right. So that is adding to the sticker price, if you will, that the Jamaat is seeing. I will tell you one thing, though, that many of our Jamaati members that do have income above 400% of the federal poverty line, if they are business owners and if they own small businesses, they should look at the at setting up, perhaps, if possible, a small group plan through their company. I will tell you that they may realize savings of up to 10 to 15% on what they would pay full price if they were buying the plan from the marketplace. That is something that a lot of our business owners were doing before the enhanced tax credits came in, and I feel that this may be time for them to go back and look at those again. Ferengis?
Thank you, Jamil. ببینین در این سلاید روی بعضی موضوعات عمده اونا اشاره کردن که ما به طور خلاصه براتون فشردیش بیان میکنم که گفتن. ببینین در این سلاید شما دو رنگ زیادتر قابل توجه شما خواهد بود که رنگ نارنجی است و رنگ آبی در قسمت این طرف دست راست سلاید، که این دو رنگ دو موضوع عمده را بیانگر هستند که گفتن کس امی باکس یا بخشی که رنگ نارنجی است این تخفیف های فعلی روی پریمیم ها را نشان می دهد و دیگه ای که یکی از این تخفیف ها کردیت مالیاتی تقویت شده یا امو enhanced tax credit است. درست؟ و در تاریخ 31 دسامبر 2025 ختم می گرده. درست؟ امی Affordable Care Act که not eligible for subsidies ای در تاریخ 31 دسامبر 2025 ختم میگردد. به همین دلیل در همین دلیل ممکن است که بعضی افراد در مبلغ پریمیم خود افزایش را مشاهده کنند. یعنی چی؟ یعنی یک مقدار پول زیادتر به مصرف برسانید، امو یک افزایش شاید شما شاهدشان باشین. و ما هنوزم یک تخفیف قابل توجهی دیگه هم ولی گفتن که بازم هنوزم یک تخفیف قابل توجهی در دسترس است. و همچنان در ختم گپای خود اینا اشاره کردن که کسایی که بزنسمن هستن یا بزنس دارن یا تجارت پیشه هستن، خوب است که اونا گفتن یک بار توجه کنن به می پلانایی که در سالهای قبل یا در سال 2025 داشتن. خوب است که یک توجه کنن یا با یک بازدید نظر از اونا بکنن که اگر بتوانن یک پلان گروپی بسازد او شاید برشان خوبتر تمام شود. Yeah. Yeah.
Amber, before you, can I just
Yeah.
add a thought to the slide here
Sure.
before we move on? So look, I know that there is a lot of concern about the high premiums, right? But if you look at it, um, while the plans are very expensive, but if you are between 100 to 400% of the federal poverty line, there is still a substantial amount of tax credit that is available to you. Yes, it will go up, and I get it, and put it in the same column as our car insurances and home insurances that have increased this year. But what I'd like to point out is that regardless of what you may be hearing, tax credits have not gone away. Enhanced have gone, but there is still a substantial amount of tax credit available to people that are wanting to buy health insurance.
Oh, I'm really glad you mentioned that, because I think that that's what kind of makes headlines sometimes. Even me, I'm like hearing, oh my God, so many people's premiums are increasing, but there are still subsidies available. There are still tax credits available. There's still discounts, right? And it also seems like the discounts really is based on your income, right? Like that's a key number here to determine what kind of discounts you're eligible for. So, some people, their incomes are pretty stable, right? Like they kind of know how much they're going to make, more or less. But others, it's not so consistent year to year. So if we don't know our income, do we just guess what will
Yeah.
happen next year?
Yeah, no, great question. So now for the last 13 years, and those of us that have been involved with the marketplace for the first year now actually know the drill, right? It's so one thing I want to point out is the year of income that you need to project is the year in which you are getting the health insurance. All right. So
Next
for
year.
now, exactly. So now we're doing it for 2026. So what they're asking people is that, hey, what do you think your income will be in 2026 that you will file in 2027, right? It's not this year's. And that sometimes, exactly, that sometimes makes it difficult. Now, unless you are on a regular income, then year after year, there's a little bit of increase, but not much, right? I think it becomes challenging when you are a self-employed person, right? And so the changes that are coming for next year, for 2026, for the tax year when we will file in 2027, we need to be a little bit more accurate in how we project, because we could ultimately face a large tax bill at the end of the year if we're not careful. And I'll tell you why. So in 2025, suppose I said, hey, my income is going to be 25,000, right? And I actually ended up with 35,000. All right. I had a good year, whatever. So now when I went to file tax returns, the IRS looked at me and depending on where I fell in those three categories that you're seeing on the screen, under 200% and the three, they would actually, instead of me having to pay back every penny of the excess tax credit that I should not have gotten, they just had a flat figure. Either you pay back whatever you owed, or up to 375 for a single person if you're in the lowest bracket, right? And that was it. Call it even. You're good. I'm good. But that is changing. Starting from 2026, there is no more cap. Whatever excess that I got in tax credit that I should not have gotten at 35,000 instead of 25,000, that difference I'm going to have to pay back every dollar that I owe to the IRS.
Ooh.
No more sort of caps. No more like, hey, Jamil, you're a good guy. We'll just take 375 from you. No more.
Yeah.
I have to give back everything. And that goes across all levels now, right? Of course, above 400%, there was no cap anyways. But I want to caution something here, and I think this is something that is going to make a lot of difference for members that are closer to the lower 100% lower income or the 100% of the federal poverty line. Look, if I'm closer and I know my income is going to be close to it, 16,000, 17,000, whatever, right? And for whatever reason, I am not able to make that minimum requirement number and I'm below that, well, the new rule dictates that when I file taxes, they will say, oh, you should not have gotten a single penny in tax credit. And I may be required to pay back every dollar that I received in the tax credit. For some people, that may amount to a huge amount of tax that they may owe to the IRS. So it's very important ever before, and as you said, there are times we don't know, to be as accurate as possible based on your historics. Maybe talk to your tax advisors before predicting your income for 2026, just so that you don't have a large tax bill at the end of the year. Fergus?
Okay. All right. I think this is one of the most important points you've made so far because it really could impact people financially in the future. And we're doing a lot of projections, right? We have to think about what's going to happen in the future. So
Sure.
what you're saying is that we really need to have the most accurate estimate for our income as possible so that we don't have to pay back extra tax at the end of 2026, 2027 year. Jamil, can you actually reiterate that in Urdu for me too? And then for Angeet after that in Dari, because I think that this is a big change for this coming year.
ऑलराइट सो मैं ट्राई करता हूँ देखें अभी हम जब टैक्स रिटर्न फाइल करते थे तो अगर हमारे पास हमने जो प्रोजेक्ट की थी इनकम उससे ज़्यादा अगर इनकम हो गई तो हम जब टैक्स रिटर्न फाइल करते थे ना तो आईआरएस हमें कहता था कि ठीक है बेस्ड ऑन जो आपका लेवल है 200%, 300%, 400%, आप हमें सिर्फ अप टू 375 दे दें एंड दैट्स इट। हम आपसे उससे ज़्यादा नहीं मांगेंगे। बेशक आपका टैक्स क्रेडिट जो आपको ज़्यादा मिला था वो बेशक उससे ज़्यादा होता था, तो वो आपको कुछ नहीं कहते थे और ये साल के एंड तक वो वैलिड है। नेक्स्ट ईयर से ये चेंज हो रहा है। 2026 से का जब टैक्स रिटर्न हम फाइल करेंगे 2027 में, उस टाइम पे वो देखेंगे कि अगर हमने जो इनकम प्रोजेक्ट की थी उससे कितना ज़्यादा हमारी इनकम हुई है और जो डिफरेंस है ना टैक्स क्रेडिट का जो उन्होंने आपके बिहाफ पे ज़्यादा दे दिया था इंश्योरेंस कंपनी को, वो आपसे पूरा पूरा अमाउंट वापस मांग लेंगे। डिपेंड नहीं करता कि आप जिस भी लेवल पे हो, 200 पे हो, 300 पे हो या 400 पे हो, डजेंट मैटर। सबसे इंपॉर्टेंट काम यह है कि अगर कोई लोअर इनकम की तरफ है, बेरली अबव जो 100% फेडरल पॉवर्टी लाइन हमने देखी थी नंबर्स, अगर वो उससे थोड़ा सा भी ऊपर है, ठीक है, और खुदा ना खास्ता जब वो टैक्स रिटर्न फाइल करते हैं उनकी इनकम 100% से कम होती है, तो उस टाइम पे आईआरएस आपको बोलेगा कि हमें तो आपको टैक्स रिटर्न आपको टैक्स क्रेडिट देनी ही नहीं चाहिए थी क्योंकि आपने मिनिमम मीट ही नहीं किया था। और उस टाइम पे पॉसिबल है कि वो आपसे जितना भी आपको टैक्स क्रेडिट मिला है साल का वो आपसे वापस मांग लेंगे।
Hmm.
और उस टाइम पे आपको जो टैक्स बिल आएगा आईआरएस से वो बहुत बड़ा हो सकता है। तो मेरा रिकमेंडेशन ये होगा कि आप जितनी हद तक अपनी इनकम एक्यूरेटली प्रिडिक्ट कर सकते हैं प्लीज करें। क्या होगा नेक्स्ट ईयर वो तो किसी ने नहीं देखा, लेकिन जो बेस्ट आप आपका प्रिडिक्शन कर सकते हैं वो करें ताकि साल के आखिर में 2027 में आपको कोई बड़ा टैक्स बिल ना आए।
Thank
फर्नगीस।
you.
Yes, that's really important point. ببینین اینا در تمام امی لابلای گپ های خود از موضوعات بسیار خوب اشاره کردن که مهمتر و مهمتر موضوعی که اینا به هم زبان اردو هم انگلیسی تاکید کردن که شما هم شاید شاید ای گپ بوده باشین کسایی که انجام دادن که در سالهای قبل یا در امسال 2025 قسمی بود که مثلا ما اگر یک مثلا کار میکردیم یا درآمدی که داشتیم وقت زمانی که امی فایل کردن تکس میرسید بعد ما چی کار میکردیم که حتما یک مقدار امی درآمد خود بالاتر یا پایینتر ذکر میکردیم و که در سابق یک نتیجه داده، یعنی برای بعضی کسا خوب تمام شده یا برای بعضی کسا خوب تمام نشده، ولی ای بود، ای پروسه وجود داشت. مگر در سلاید قبلی هم که در FPL یا سطوح فقر بر ما تشریح کردن که در سال آینده که 2026 و 27 می باشد که باز ما تکس 2026-27 خدا فایل کنیم، این کار دیگه کاملا رد شده، یعنی رد می شود. به چی معنا؟ به این معنا که چیزی که بسیار بسیار مهم است که ما باید در نظر بگیریم این است که چی میکنیم؟ ما باید دقیق ترین تخمین ممکن است از درآمد خود را داشته باشیم که نه بالا نه پایین، اما دقیق ترین تخمین گفتن درآمد خود را داشته باشین تا در پایان سال مجبور به پرداخت مالیات اضافی نگردیم. ببینید این تنها به این حالت نیست که ما مثلا مقدار درآمد خود را بالا بگیم بعد باز ما در آخر سال یک مقدار مالیات اضافه داده میشیم. در برعکس، یعنی در دو حالت اگر نظر به تعداد یا مقدار درآمد خود اگر پایین بگذاریم هم و ما دچار مشکلات میشیم، دچار مشکلات یعنی که پرداخت مالیات اضافی میکنیم، و اگر بالاتر بندازیم هم در اون حالت ما مالیات بیشتر باید پرداخت کنیم. پس به او حالت پس به این خاطر اینا میگن که نو کپ هیچ نوع، یعنی داده گرفت معامله صورت نخواد گرفت در سال 2026-25، اما دقیق درآمد خود را تخمین کرده بعد باز به تکس فایل کردن برین. و همچنان گفتن که اگر خودتان اقدر ماهر نیستین یا اصل کمک ضرورت دارین، خوب است که یک ادوایزر یا یک تکس اجنت دیدن نمایید، بعد باز فایل به خاطر فایل کردن تکس های خود اقدام کنید. Yes, Jamil?
Thank you, Ferengis. So I know that we're running a little short on time, and we want to get to the Q&A. So Amber, I'm going to cover the next two slides fairly quickly. And I'm going to try and see if I can cover this in Urdu as well. जो 100% फेडरल पॉवर्टी लाइन से नीचे का प्रॉब्लम है, वो अगर आप ऐसे स्टेट में रहते हैं जिसमें मेडिकेड एक्सपेंशन है, और आप अगर इस मैप को देखेंगे तो जो ब्लू में है ना, वो स्टेट्स ने मेडिकेड एक्सपेंशन किया हुआ है। उसका ये मतलब हुआ कि अगर आपके पास इस स्टेट में इनकम नहीं भी हुई तो इस स्टेट ने एसीए के लिए अपना मेडिकेड एक्सपेंशन कर दिया है, तो आपको स्टेट के मेडिकेड से आपको एसीए के प्लान्स मिल जाएंगे। तो आप अगर उस स्टेट में हैं तो आपको वहां फिक्र नहीं है। प्रॉब्लम आ रहा है आई थिंक इट्स ऑरेंज में है। ओके, इन स्टेट्स में आप अगर आपके पास 100% फेडरल पॉवर्टी लाइन से नीचे है तो वो जो है ना, आप अनफॉर्चुनेटली जो प्रॉब्लम वहाँ आता है, मैं आपको नेक्स्ट स्लाइड में दिखाता हूँ। नेक्स्ट स्लाइड प्लीज। देर इज अ थिंग, जैसे आपने देख लिया कि ग्रीन के अंदर जो लिखा है ना, नो कवरेज। अनफॉर्चुनेटली इन द स्टेट्स जिनके पास मेडिकेड एक्सपेंशन नहीं है उनके पास ये प्रॉब्लम है। ठीक है, आई थिंक अंबर इस बारे में थोड़ी सी आपको बताएंगी कि इसके लिए क्या रिसोर्सेज आपके पास अवेलेबल हैं, लेकिन देयर इज अ थिंग अनफॉर्चुनेटली इन द स्टेट्स दैट आर ऑरेंज where there is a problem with no coverage for certain segments of the population. Ferengis?
Yes. ببینین امی دو یا سه سلایدی که پشت هم اینا تشریح کردن، قسمی که در گراف بگوییم یا چارت بگوییم شما میبینین، اینا میگن که بعضی از ایالات هستند که قسمی که در نقشه شما میبینین اینجا در روی سلاید، دو رنگ بازم دو رنگ شما مشاهده میکنین که نارنجی و بلو بگویم یا آبی یا نیلی شما میبینین. این بر ما چی را تشریح میکنه؟ تشریح میکنه که در ایالاتی که تحت پوشش قرار گرفتن در برنامه میدیکید یا ایالات های آبی یا بلو، اونها ایالات های هستند که امی گرفتن میدیکید آسان تر است. درست؟ پس اونا نباید نگران حداقل درآمد باشن. اگر در ایالات هستند که با رنگ نارنجی مشخص شده هستند قسمی که در اینجا میبینین مثال مثلا تکساس، بعضی جایهای دیگه تکساس و بعضی جورجیا، اینا جایا یا استیت هایی هستند که ممکن است برخی از افراد در شکاف پوشش قرار بگیرن، یعنی هم برای تخفیف های ACA واجد شرایط نمیگردند و هم برای مدیکید واجد شرایط نمیشوند. دهی مناطق یا استیت هایی که نارنجی هستند کمی دشوارتر و حتی ناممکن هستند و کسایی که در استیت هایی که با رنگ آبی هستند در اونجا بوده باش می نمایند، بر اونا آسان تر هستند که مدیکید یا از امی برنامه ACA برخوردار شوند. درست؟ و دیگه گفتن به خاطر از اینکه چطور ما بتانیم از ریسورس ها یا منابعی که ما را کمک کنن که ما برخوردار این برنامه ها شویم، انبر شاید بعضی معلومات ها را با ما در اشتراک بگذارد در صورت این بعدی. تشکر. یا انبر.
Thank you. Okay, so unfortunately, it seems like some people, depending on where they live and what resources are available, there may be a coverage gap where you don't qualify for ACA and there's discount, or you don't have Medicaid, expanded Medicaid in your state. So if you find that you fall into this coverage gap, we recommend reaching out to your local health board to identify resources that may be available for accessing basic healthcare needs. I'm going to shift gears just a little bit. I know, Jamil, you've helped us understand a lot of the changes that are coming, and some of them are not as exciting. But I think that I'm going to ask you about one more change, which I do think is exciting. I heard bronze plans now are eligible for HSA. Is that true?
Yes, that is true, and perhaps a silver lining. In the past, if you got a bronze plan generally have high deductibles and high out-of-pocket max, right? So before I proceed, I want to caution that bronze plans may not be best for everybody, especially if you need a lot of healthcare issues, healthcare needs, and have health issues. It may not be the best one for you. All right. However, given what we're seeing with the price, it may be a good compromise between people not getting health insurance or at least having insurance but having a bronze plan. Okay. Let me tell you a little bit about how that will work. Health savings accounts, HSAs, can be something that you can establish with your local banks. Most banks let you do that, and then you can use that money to pay for your medical expenses, right? But you can only contribute to a HSA if you have a bronze plan, right? So your money goes tax deferred, which is good because you're saving on taxes. And by the way, for an individual person, you can put up to $4,400 annually into the HSA. And if you are above 55, you can actually do another $1,000 for catch-up contribution. The benefit of this is, obviously you are saving money on your premiums by maybe getting a bronze plan because they relatively are cheaper than silver and gold plans, number one. Number two, the money that you put into your account you get a tax break on that, right? Whatever tax bracket you are, you're saving that much money. And you can take the money out and pay for many qualified expenses, such like your doctor visits, prescriptions, dental, vision, your deductibles, hospital stay, all of that. As long as that's a qualified medical expense, you can pay for it. And I think the wonderful thing is that year after year, it rolls over. So if I have a bronze plan this year and I don't have a bronze plan next year, it doesn't matter. Now, because I don't have a bronze plan next year, I can't contribute to it anymore. But whatever money that is left in there, I can continue using it for my health care needs until the money runs out. And if in subsequent years I get a bronze plan again, I can again contribute to the HSA. Not everything, but I think for certain segments of a Jamaat, this may bring some reprieve. Hangis?
Yes. دیدین اینجا خانم انبر گفتن که مثلا ما درک میکنیم که در سلاید قبلی که بعضی از استیت های امریکا مثلا نمیتونن که واجد شرایط امی چیز مدیکیت شون که یک خبر جگر خونن کننده بگویم هستن بر بعضی استیت ها نظر به مو پلانا و درآمدی هایشون. ولی باز اینا از پکیج بگویم یا از پلان صحی دیگه که به نام HSA هستن که Health Saving Account. از اینا یاد کردن که یک کمک خوشخبری میارن بر بعضی خانواده و بعضی فامیلا که امی پلان های برونز یا حالا که برای حساب های HSC واجد شرایط می باشن که هستن اولی که حساب HCA به شما اجازه میده تا پول قبل از مالیات رو در آن اضافه کنید. از این رو مثلا شما روی آن مالیات پرداخت نمی کنید و همچنین میتونید از آن برای پرداخت مصارف مرتبط به مسائل صحی و طبابت مانند ادویجات یا نسخجات یا مثلا ملاقات های دکتر فامیلیتان و همچنان همون کسرهایی که به نام دیدکتیبل و غیره هستن استفاده کنید که این یک نقطه خوبی از این پکیج می باشد یا پلان بگویم مستر. و دیگه نقطه که بسیار خوب است در این پلان ای است که فرض مثال اگر شما این پلان شما رجیستر کنین یا خود انرول کنین یا همی پکیج داشته باشین، مقدار پول یا فند که در می پلان شما می داشته باشین با خد مثال اگر شما استفاده نکرده باشین در جریان سال به خاطر دیدن دکتر یا به خاطر دنتال ویژن یا هر چیزی که شما ضرورت داشته باشین که ضرورت نداشتین و استفاده نکردین، یعنی او قدر به دکتر نرفتین به طور عامیانه بگویم، اما مقدار پول یا فندی که دمی پلان شما هست ای در خط به سال اتومات از بین نمیره. چی میشه که بر سال آینده ای ترانسفر میشه، یعنی انتقال میافته به سال آینده تمامی همون مقدار پول یا فندی که در سال قبلی شما داشتین، که این یک نقطه خوبی از این پکیج یا پلان بگویم هسته. و دیگه اینا اشاره کردن که ای بر بعضی فامیل ها نظر به امو درآمدشان خوب تمام میشه و دیگه نظر ده حالت امو صحی از اونا که یک شخص چقدر نظر دمو صحت و سلامتی خود میفهمه که من در یک سال چند بار باید به دیدن دکتر برم، درست؟ پس این پکیج اگر او قدر زیاد به دکتر رفتن نباشه خوب پکیج است، ولی اگر شما نظر به حالتهای استرالیتون که در یک سال زیادتر دکتر براین، پس ای فند یا بودجه شما در یک اکانت خلاص شد، باز مجبور که به سال دیگه باز چیزی نیست که شما را انتقال بدهین. گفتن با مو دلیل گفتن که فقط یک نقطه را در نظر داشته باشید که این پلان ها دارای کسرهای دیدکتیبل بالاتر هستند و حد اکثرهای بالاتر از جیب شما است که باید از جیب خود پرداخت کنین. بنابراین این نقطه را گفته دقیق توجه کنین که آیا امی پلان به خودتان و خانواده تان یک پلان درست است یا خیر. یا جمیل، امبر.
Great. I am going to just take a few moments to go through our dates. I'm actually really glad we talked about HSA because I like using HSA plans, and I know they can be better. I even paid for my eyeglasses with my HSA plan. So let's move on to dates. I know we are coming towards the end and people are very eager with their questions. So I will go through this very quickly. The important dates are listed here, and open enrollment is already ongoing for the 2026 year. December 15th is the first important deadline if you want your insurance to begin on January 1st, which I think most people do. The full open enrollment ends for most states on January 15th. And then if you enroll after December 15th, so between December 16th and January 15th, your plan will not start until February 1st. Next slide, please. All right, I'm just going to summarize here. Jamil, you shared a lot of information with us today. Thank you very much. I just want to summarize kind of 3 big points. So one, the enhanced tax credit is ending, but there are still many discounts available through the subsidy for those who meet the requirements. We need to make sure that our income estimates are as accurate as possible. You talked about having to maybe, if they're not accurate, we may have to pay back extra tax at the end of the year. And it's advisable to work with a health insurance agent for questions related to your personal circumstance. and local health boards are also available to connect you with local agents.
Mhm.
Ferengis?
Yes, Amber, can you go back to the chart, like previous slide?
Sure.
Yes, important dates. ببینین اینجا انبر با بعضی تاریخ‌های مهم ما را مثلا اشاره کردن که اگر ما بخوایم که بعضی از این پکیج ها را داشته باشیم، قسمی که در چارت شما میبینین Open Enrollment شروع شانه و ختم شانه بر ما ذکر کردن. شما میتونین یک عکس زیر بگیرین یا هر قسمی که بر شما راحت است. تاریخ شروع و ختم شانه نشان دادن و همچنان کدام استیت ها در کدام نظر به استیت اونجا ذکر شده. وبسایت هایشان هم اونجا ذکر شده که شما از این طریق میتونین که امی پکیج ها یا امی پلان های خود داشته باشین که yes and also دیگه اینا گفتن که به طور سمری یا خلاصه امی تمام امی وبیناره که اگر ما بگوییم در 3-4 جمله مختص بسازیم یا خلاصه بسازیم ای هستن که گفتن که اول از همه ای که اعتبار مالیات تقویت شده یا enhanced tax credit در حال پایان است، اما تخفیف از طریق سبسیدی همچنان جای خود را به جای خود باقی است، یعنی به جای خود برقرار است. به چی معنا؟ به این معنا که اگر enhanced tax credit در حال خلاص شدن یا خلاص شدن هستند، ولی امو سبسیدی یا دیسکانت ها هم وجود دارد اگر ما کمی پشتش بگردیم و پیدا کنیم. و دیگه ای که نقطه که باز هم به روی اینا تاکید کردنی که ما باید امی درآمد سالانه خود را هر قدر دقیق تر پیش بینی کنیم. خوب است که در آخر سال به مالیات ما کمک میکنه و بازم یاد کردن که اگر خود ما نمیتونیم، خوب است که یک اجنت یا از ریسورس های که در طریق جماعتخانه از اینجا هستند باید پیدا کرده و امی محاسبه خود دقیق تر ساخته پس تکس خود فایل کنیم. و دیگه همچنان اینا گفتن که توصیه می شود برای پرسش های مربوطه به شرایط شخصی خود با یک نماینده بیمه سلامت یا صحی همکاری کنید. به این معنا که در بوردهای صحت محلیتان در هر عرصه در عرصه‌های مختلف اینمی موضوعاتی که امروز صحبت شد هستن نفرایی که شما را همکاری و حمایت خواهد کرد. Yeah, thank you.
Thank you. Okay, some final thoughts, if we will. Jamila, I'm going to ask you, put you on the spot for one more question. Actually, no, we have more questions for you, but one with the PowerPoint. So there's been a lot of speculation about the future of ACA. I think that's a lot of where the questions are coming from, a lot of where the confusion is coming from. So we've already seen some changes for this year, like you've explained. Can you kind of summarize what is in question for the future?
Yeah, wish had a crystal ball, so I could tell you exactly what's going to happen. But in the absence, let's just first talk about what we do know. Okay, so as of today, we know that the subsidies, the enhanced tax subsidies, are going to end on December 31st, 2025. Okay. But the original subsidies, as they used to be before 2021, are going to stay, right? Look, I'm going to tell you, and I think a lot of the questions are also coming from there is a bipartisan effort in the United States Congress as we speak that are trying to figure out a deal where the tax credits can be increased for perhaps a temporary time, a year or two, as soon as they can come up with a compromise, and then perhaps try and fix whatever it is that they want to do down the road. Having said that, that is not certain. We don't know, as happens in the state capital, in the U.S. Capitol, things sometimes don't work out. So I wouldn't recommend that what I would recommend is that we continue looking at it and see how things go on. But I think what we need to do today is make our decisions on what we do know, right? So my recommendation to people would be don't wait until December 15th or close to it, because if there is not a deal, then you may very well run out of time to register. What I recommend is people register, because the ACA stands, it is the rule of the country still. The tax credits are available, the subsidies are still available. In the event, at least this is what the marketplace has told us initially, because very honestly, we don't know if a deal will come through, if it does, when it comes through, how that affects us, and what are some additional opportunities we may have to change things around. What the marketplace has told us to address the clients and the community at large is go ahead and pick your plans. Yes, your premiums are going to be higher. And they said that if one of the things they could do is if the deal comes through, they may automatically go and update everyone's tax credits. Now, if the deal comes in before December 31st, then your January premiums would automatically be reduced because of the extended tax credits. If they come after January and you've paid the higher premiums to the insurers, you will be able to claim that at the end of the year when you file your tax return, okay? Because you have paid more. If your income stays the same, you've paid more, like we discussed, you would get that back, okay, at the end of the year. But it all depends if and when a deal comes through. If it doesn't, my recommendation is let's just say that the enhanced tax credits are not coming, not yet, and work with the way things are today, and not risk not being able to enroll for January.
Okay, great points. Ferengis, do you want to translate a little bit of that?
Sure, of course. و به طور فاینال تاتس یا آخرین نکاتی که باید در نظر بگیریم اینا گفتن که اولتر از همه ای که اگر ما پلان داریم که از این پکیج ها یا از این پلان ها را داشته باشیم پس منتظر نشینیم تا آخرین روزی که ددلاین است. خوب است که ما اگر انرول کردنی هستیم یا رجیستر کردنی هستیم خوب است که به زودترین فرصت انرول کنیم خود در یکی از این پلان ها، چون که نظر به اخبار، نظر به قاعده و قانون هایی که هر روز قانون ها تمدید میشه و قانون های نو به وجود میآیند، گفتن که اگر ما مثلا پلان داریم که بگیریم خوب است که امین حالا بگیریم. اگر فرض مثال گفتن که یک پلان را شما گرفتین که مقدار زیاد پول باید پرداخت شود فعلا یا پرداخت میکنین، پس در سال آینده یا در ختم سال وقتی که تکس فایل کنین یا تکس کردیت خود بگیرین، اگر زیاد بود شما زیاد پرداخت کردین اونا باز شاید که یک مقدارش پس بر شما باز پرداخت نماید. دیگه ای که گفتن که بله پریمیم ها شاید افزایش بیافته ولی باز هم امو اوریجنال سبسیدی در جای خود است یا امو تخفیف هایی که وجود داره بازم تخفیف هست در هر نوع پلانی که شما پلان کنین تخفیف هست و بازم تاکید کردن که باید از اجنده که شما را در بابت کمک کنه باید کمک بگیریم. به طور خلاص امی بود به نظر من. Yeah.
Thank you. Thank you, Jamil, for clarifying that, and Ferengis for all your translations. So, this is actually a really good segue to the questions. A lot of the questions we have addressed some of these things. I'm going to ask a few. The first one is, and if you'll just reiterate it, because I know you just said this, Jamil, as the ACA's deadline is December 15th, should we go ahead and buy from the marketplace at the current rate before the deadline or wait for a better rate in case Congress intervenes? And there's many versions of the same question.
Yeah. So I'm going to tell you one thing. There is no certainty, first of all, if the deal will come through. We're all hoping, fingers crossed, right? And all of that wonderful stuff. But we don't know if a deal will come through. As has happened, there is a standoff between the different stakeholders. And unfortunately, they have to overcome quite a bit of those obstacles before a deal can come through. So my recommendation would be and then we also don't know when it comes by, and if it comes, will they open it up for people to change their plans, give you an opportunity? My sense is that would probably no. What if it doesn't even come, right? So my recommendation to people would be, as I said earlier, yes, please register, get the best possible plan you can, and make sure you can work with that budget, by the way, not thinking
Yeah.
that, hey, an enhanced tax credit comes in, it'll go down, I won't have to pay this for the whole year. What if the the enhanced tax credits don't come in, right? So let's be sure. I want to point out that the numbers you're seeing now are without the enhanced tax credits, okay? So what that means is that they converted back to pre-2021, and that's the original tax credits that you are looking, and that's why you're seeing the higher numbers. So the enhanced tax credits are not included in the pricing right now. But like I said, if it comes through, great. If it doesn't, let's make sure that you've got a plan that fits your budget and you can work with for the whole year. And get it done before December 15th, please.
Yeah, no, I think that's an important point. Like we are hoping that, some of these prices will come down, there will be changes, but we don't know. And Jamil, you actually taught me this kind of when we were doing, we have to operate with what we know now, right? We have to make decisions with the information we have now. And so looking at the prices, we have to just assume that's what it is. And like you said, making sure that we can afford that for the entire year.
One other point to consider is, look, we do get a 30-day extra grace period from December 16th, January 15th. And if a deal comes in before then, and for whatever reason, if you do need to change a plan, you still have that. So you'll have that one plan for 1 month, and you do have the chance to make a change between December 16th and January 15th, and the new plan would start Feb 1. So we need to keep that in mind as well. But I don't think we should wait until after December 15th, because you may not have a plan in January. And I don't know if you want to take that chance. So.
Yeah. What advice would you give to those who cannot afford to buy at the current high price for the plans? Are there alternatives to find a better rate than the marketplace?
Yeah, crux of the matter, right? So look, I think I mentioned this earlier. If people are above the 400% of the federal poverty line and they're getting a sticker shock because they're not getting any discounts and they're having to pay full premium, full prices, like I said, most of them tend to be self-employed individuals, may have a business. If you have a business, you may want to look at small group plans, okay? Because they do offer some affordability compared to you paying full price for a plan on the marketplace. That's a given. Okay. For other levels, I think one possible solution could be, as we talked earlier, the bronze plan, right? Just keep in mind that your deductibles are very high, but it does tend to have a lower out-of-pocket, lower premium. And I would recommend a bronze plan rather than going without health insurance whatsoever, right? At least you are hedged. And God forbid there is a medical emergency. One thing is for sure, if you forego and there is no deal, you are not going to be able to register during the middle of the year once open enrollment is finished. So I think that's another one. Look, I don't recommend this at all, but there are some off marketplace. One thing to keep in mind is any client plan, regardless of the fact you can buy it from a private company on the exchange or you buy it directly from an insurance provider, you will see that any plan that is ACA compliant will have essentially the same base prices, which are pretty high, right? So buying it directly from a insurer means you are essentially paying full price without the tax credit. In some states, actually all states also have something called short-term plans. Do not recommend it because they do not cover pre-existing conditions, don't cover pregnancy, don't cover mental health, have quite a bit of restrictions and require underwriting to pass. And in most states, it is just a 4-month temporary and they renew it every 4 months. And when they do that, they essentially adjust your rate if you've had any claims in that 4 month. So look, as an absolutely last resort, I would say if somebody wants to look at it, not a recommended one because it has substantial restrictions. But if somebody is absolutely at a point can't see anything else, then that would probably be the last resort.
Thank you. Okay, so we have a question. Will the recording of this PowerPoint be available for the Jamaat? Yes, it will be. Ferengis, can you translate the question and I'll get the answer as well?
Sure. Can you repeat one more time?
Yeah, will the recording of this PowerPoint be available to the Jamaat?
آها سوال کردن بعضی از جماعت هایی که آنلاین هستند که آیا ریکاردینگ امی وبینار پسان در اشتراک گذاشته خواهد شد یا خیر. جوابش بله، یا شما ریکاردینگ از را حتما می داشته باشید.
Okay, great. And it will be available online at akhb.thesmileyusa.org.
و شما میتونید که ریکاردینگ از این وبینار را در وبسایت akhb داشته باشید. akhb.ismaili.
akhb.thesmileyusa.org.
Yes, there you go.
Okay. All right. Got some more questions. So I have been using an ACA plan for a long time, and I'll be eligible for Medicare starting January 16th, 2025. Should I switch to Medicare or just keep renewing my ACA plan?
Great question, and I think this is very important. Understand that when you qualify for Medicare, essentially you've worked in the United States for 40 quarters, pay taxes and for 40 quarters. What that does is it makes you eligible for Medicare Part A for $0. Okay, and without getting into too much discussion about Medicare here, it makes you eligible for Medicare Part A, which is hospitalization. The rule is, as soon as you become eligible for a Medicare Part A at $0, you cannot continue to get subsidies from the marketplace. So the answer is you do need to transition to Medicare. And if your birthday is in January, then your Medicare actually will start Jan 1. You should work with Social Security, go to their website or call them and have them sign you up for Part A and Part B and transition to Medicare.
And Part D for prescriptions, says the pharmacist.
Yes. Which, by the way, comes as a second step.
Yeah.
First, you got to get to your Part A and Part B.
Yeah. Okay, thank you. All right, our next question is, I'm seeing a lot of insurance agent ads on my Facebook reel saying they can get the coverage for significantly less, by as much as half, lower than ACA. Some of them even say that for business owners, their options are better than the ACA. Are they scamming, or are there better options outside of ACA?
Okay, so the second part of that, maybe, as I said, business owners can perhaps look at getting group insurances. I don't know if they're referring to group insurances or not. I will tell you, yes, if someone says they can reduce your ACA premiums by half, the first thing you need to ask is ACA compliant. What that means is, will they cover my pre-existing conditions? Will they cover maternity if there is a need for that? Or mental health? Will they cover my prescription coverages? And I can tell you that they will tell you that they can't. And they're supposed to tell you that, unless it's a scam, in which case I wouldn't go with that. I will tell you, and I always say this, is there is a reason there is a fine print, and it's in small print because they don't want you to read everything. So the question is, if you get into a plan like this, they send you information, go directly to the fine print, make it bigger and read it, and you will see that it is not what it all says. And I would, by the way, the marketplace is actually making stringent efforts to cut down on these false fake advertisements. So if there is something that you see and you get scammed, you can go to the healthcare.gov and actually make a complaint about, add a picture of that Facebook ad so that they can take proper actions against these bad actors.
Okay, great.
Yeah.
I think the one thing that you kind of repeated in different questions is that, there might be some other plan. They might not be ACA compliant. So the ACA, covers preventative medicine, preventative visits, wellness visits, preventative procedures, and other plans may be short term. The rates can change, may not have all coverages. I think you explained one of them doesn't even cover pregnancy, which, obviously is can be will require a lot of visits, right? And that will add up. So just everyone being very mindful and reading the fine print, I think is a good piece of advice.
Amber, just to add to that, I think if you actually looked at some of these short-term plans that are being advertised, and by the way, these Facebook ad may actually very well be referring to those, right?
Yeah.
Because what they're trying to do is lure away, and if you qualify, they'll sell it to you, right? Because they will put you through underwriting, right? I think the one thing that I have noticed is that even the cost of these temporary plans are actually fairly high.
Yeah.
And so I would caution people to look at that and compare that to a bronze plan.
Yeah, good point. There is a question. Let's see, I'm running on time. How does bonus work for income? I'm not sure if you or if you have any side income.
Okay,
That might be a little, I'm
well,
not
so yes. Okay, so I think what they're asking is that what income is reported for the marketplace. If what if I have a fixed income, but then I also get bonuses at the end. Okay, so
Yes.
so I'll tell you what you need to do. Okay, what they look at is modified adjusted gross income, MAGI. All right, and what they look at is your line 11 of your tax returns. And that includes your wages, your bonuses, and all your self-employed income that all comes in and that shows up on line 11. So the answer is yes. And by the way, modified adjusted gross income means that if you are getting any income that is generally not taxable, that actually gets added back into it. So if you have tax-free interest from municipal bonds, or you are getting income from overseas that you report but don't have to pay taxes on it, be careful. Those get added to your modified adjusted gross income. And
Oh,
for further, I'm not a tax guy.
yeah.
So, this is my limited knowledge. My recommendation would be people that are concerned about this should talk to their tax professionals.
Yeah, great advice. Okay. We'll keep going because we do have questions. Okay, and for Geese, we may ask you to do some translation here too. How can students apply? I think this, so maybe we can address the age, Jamil.
Yeah. So look, there is no special provision for you being a student. Okay. If you're a student, and your parents have a ACA market plan, and if you're still their dependent, you can have a health insurance plan through you. However, if you're a student in another state, that is a problem with ACA plans because most plans are only state-based. So you may want to have them look at an insurance through their school, number one, right? But if I'm a student by myself, I'm above the age of 23, I am going to my master's, there is not any provision specifically stating that because I'm a student, I get a special discount or a special rate.
Frank, you can translate and I'll ask one more follow-up question.
Sure. Sure. سوالی بودن که گفتن پرسیده کسی که یعنی امی ACA برای شاگردا چطور خواهد بود؟ یعنی آیا بخواد کسایی که شاگرد هستن آیا کدام تخفیفی بر اونا خواهم بود یا نه خیر؟ اینا گفتن که امی ACA اگر فرض مثال فامیلتان یا اگر شما عضو خانواده یا فامیلتان والدینتان از ACA برخوردار هستن یا امی پکیج یا پلان ACA دارن در بعض مراحل هستند که شما اتومات یعنی آنمو جزی از پکیج هستین و همچنان اینا گفتند که خود ACA تقریبا قسمی است که استیت بیس است. اگر فرض مثال شما در یک استیت زندگی میکنین ولی به خاطر تحصیلات خود در یک استیت دیگه میرین، پس در او حالت شما نمیتونین که از برنامه ACA استفاده کرده بتونین به طور درسته، چون که گفتن که استیت بیس هستن. پس در مو استیتی که هستی امونجا شاید کار بده ولی در استیت دیگه جای کار نخواهد داد. و همچنان گفتن که بعضی کسا سوال کردن که آیا کدام دیسکاونت یا کدام یعنی مزایای بیشتر وجود دارن اگر شما شاگرد باشین و بگین که من استودنت هستم باید دیسکاونت خوبتر یا زیادتر بگیرین؟ جوابش نه خیر، هیچ کدام دیسکاونت به خاطر شاگرد بودن وجود نداره. Yep.
Thank you. And then Jamil, just clarify, the part of the ACA was that is it people up to age 26 can fall under their parents?
Yeah, so that is a bit of a nuanced answer. Okay.
Oh.
So what the ACA did was it didn't just talk about the exchange. Okay. It covered small groups as well as individual health insurance that you get from your employer. So when they say that you can stay on your parents' insurance up till age 26, that was more geared towards employer insurance. What used to happen is when you had your employer insurance, as soon as your child turned 21, they had to roll off your as a dependent for your employer-based coverage. That has changed. Now, if you have coverage through your employer, your child can stay on your insurance even after they're out of school and they're become professionals up to age 26. Okay? So that actually addressed the issue with you being on your employer coverage. It's a bit more nuanced when it comes to ACA plans, right? If my child graduated from college at age 23 or 24 and went on to get a professional job, because I can't claim him or her as a dependent on my tax return, I can't keep them on my ACA anymore.
Okay.
Make
All
sense?
right.
And
Yeah,
to your earlier question about a student, right? If the student cannot be claimed as a dependent on their parents, they would have to buy health insurance just like any other adult based on their income from the marketplace if they're not getting coverage from their employers.
got it. Okay. Thank you for that clarification. And I know there's still a lot of questions. In the interest of time, I'm gonna ask you one more question. I just want everyone to know that, please contact us at Access. I'll give you the phone number. There are local insurance agents available in some Jamaat Khanas. And if they're not available in your Jamaat Khana, reach out to Health Board and they will connect to you. The last question, which I think is an important one, is can we apply in the middle of the year?
So yes and no. So the answer is no if you do not qualify for a special enrollment period. Okay, so suppose you decided not to take it now, and then 3 months down the road you decided I want to now get it. They won't let you get in unless you qualify for a special enrollment period. There are specific ones. So, for example, people that had a health insurance through the company, they got laid off, they have 60 days to enroll. So they can do that. If they moved from outside the United States after having a permanent home outside the United States, they come back and they establish that now they have moved back permanently, they may be able to enroll. The other one I think is very valid is somebody that came to the United States and was waiting for their immigration status to get finalized. Once their immigration status gets finalized, into a green card or whatever, that does open up the open enrollment for them in the middle of the year as well, right? But apart from those, and of course there's a baby, or if somebody got married, other than those, or moved, other than those, no, you cannot if you don't have a valid reason to enroll in the middle of the year.
Great. Thank you, everyone, for these great questions. I know there's still more remaining, but we are going to wrap up the questions now. I just really want to give a special thank you to the Jamaat for participating. I know that this has been a really important and vital topic for many of you. Special thank you to Jamil and Ferengis. You guys both have been excellent in providing us with so much valuable information, and I hope Jamaat will reap the benefits. If you have any remaining questions, please reach out to your local health board, and they will be able to provide more information and resources based on your region. And health insurance agents are also available if you reach out to your local boards. So if you have additional questions, you're also welcome to contact the Access Help Desk at 1-844-552-2237, the same number that we are all hopefully familiar with. And the recording will be available hopefully in the next few days on the smiley.org website. Ferengis.
Yes و گفتن نظر به خاطر از که وقت همگی را قدردانی کنیم از این بیشتر شما را منتظر نمانیم به خاطر از که اگر کدام سوال شما بی جواب مانده باشد شما میتونین که به این شماره که Access Help Desk است در اینجا زنگ زده پرسان کنین یا ای که در ایمیلی که در بالا ذکر شده ای که hb.smileyusa.org از این طریق یا ای که از طریق لوکال هلت بورد هایتان که حتما شما شماره یا معلومات های از اینا را دارین. از این طریق هم میتونین گفت اگر سوالایی هستن که تا بال جواب نگرفتین، شما میتونین که جوابای خود را از این طریقا به دست بیارین. و ریکاردینگ ای وبینار امی وبسایتی که بازم در روی صفحه میبینید، در اینجا در بین 2-3 روز آینده نشر خواهد شد. تشکر از اینکه آمدین در این برنامه اشتراک کردین. خدا کنه که یک تعداد معلومات های خوبی را با خود گرفته باشین از این برنامه.
Okay. Thank you again, Jamaat. Have a good rest of your day or evening if you're on the East Coast like me. Thank you, and Yalimudet.